Are you managing diabetes and constantly feeling tired, foggy-headed, or dealing with nerve pain? You might be missing something crucial. In this video, we'll break down 3 powerful vitamins that every diabetic needs to know about. These aren't just random supplements, these are science-backed, life-enhancing nutrients that could make a real difference in your daily energy, nerve health, and blood sugar control. Let's dive right in. Vitamin B12, methylcobalamin. First up, methylcobalamin, the active form of vitamin B12. This one's a big deal. Up to 30% of people taking Metformin, the most common diabetes medication, end up with a B12 deficiency over time. And here's the kicker, B12 deficiency doesn't just leave you tired. It can worsen diabetic nerve pain, cause numbness in your hands and feet, and even affect your balance, memory, and mood. Metformin interferes with B12 absorption in your gut. So even if you eat well, you might still be running low. And because your liver stores years' worth of B12, the symptoms can creep in slowly, often mistaken for just aging or stress. Severe deficiency can even shrink your brain over time and raise your risk of heart disease due to elevated homocysteine levels, a damaging amino acid that B12 helps control. But the good news: supplementing with 1,000 to 2,000 mcg of methylcobalamin daily, or getting weekly B12 injections, can restore your levels quickly. Many people notice improvements in energy and nerve symptoms in just a few weeks. And yes, B12 is safe at high doses. Your body simply flushes out what it doesn't use. Some of the best food sources include beef liver, over 3,000% of your daily B12 needs in a 3-ounce serving. Clams, sardines, and salmon, rich in both B12 and heart-healthy fats. Fortified nutritional yeast, great for vegans. Folic acid, vitamin B9. Next, folic acid, also known as vitamin B9. This vitamin is essential for nerve health, energy, and heart protection. It helps your body break down homocysteine, just like B12, and here's something you may not know. Metformin can lower folate levels by 15 to 20%, especially with long-term use. But there's a twist. Folic acid must be converted into its active form l-methylfolate to work in your body. And about 10 to 15% of people have a genetic mutation, MTHF, that makes this conversion inefficient. That means you could be taking folic acid and still be deficient. What does that look like? Chronic fatigue, brain fog and forgetfulness, worsening diabetic neuropathy, higher cardiovascular risk. Even worse, excess folic acid can hide a B12 deficiency, delaying treatment and allowing nerve damage to progress. So it's vital to check your levels and work with your doctor. The fix: consider taking l-methylfolate instead of regular folic acid if you have the gene variant and aim to get folate from natural sources like spinach and leafy greens, avocados, lentils and beans, asparagus and broccoli. Supplements can help to just be sure you're taking the right form. Vitamin D. Last but not least, vitamin D. Most diabetics are deficient in this essential hormone vitamin, especially in colder climates or if you have darker skin. Vitamin D plays a vital role in improving insulin sensitivity, supporting immune health, reducing inflammation, and protecting your heart and kidneys. Low vitamin D levels are linked to worse blood sugar control and higher risk of complications in type 2 diabetes. What should you aim for? Get your vitamin D levels tested. Many experts recommend keeping it above 40 ng per milliliter. If you're low, a supplement of 2,000 to 5,000 EU daily can help, ideally with a fat-containing meal for better absorption. Natural sources, fatty fish, egg yolks, and sunlight, about 15 to 20 minutes of midday sun on bare skin. Final thoughts: diabetes management is about more than just blood sugar. If you're feeling tired, dealing with nerve issues, or struggling with energy and focus, these 3 vitamins might be the missing link. Vitamin B12 for nerve repair and brain health. Folic acid for energy, nerves, and heart protection. Vitamin D for insulin sensitivity and inflammation. Don't just guess, get your levels tested, work with a healthcare provider, and optimize your routine for real results. If you found this video helpful, hit the like button, share it with someone managing diabetes, And don't forget to subscribe for more science-based health insights every week. Stay healthy, stay strong, and I'll see you in the next one.